Good morning, students. We'll continue with the body fluids and body components. So, in that, we covered the basic introductions to body fluids. Then, we covered the erythropoiesis, how the form elements are formed. Then, we did erythropoiesis, that is the formations of RBC. Then, we did synthesis of hemoglobin. Now, we'll see the pathophysiological variations in RBC. So we know that one of the function of RBCs is to carry oxygen, is to transport oxygen to cells and tissue, and uh, uh, to carry carbon dioxide from cells and tissue to into the lungs for exhalation. So what if this oxygen? What if this hemoglobin levels goes down, uh, which is required for transport of oxygen? So the condition where hemoglobin level goes down, it's called anemia. So hemoglobin level reduced below the lower limit of normal range for age and sex of the individual. So in adult, the normal value of hemoglobins are 13.0 gram per deciliter, so they are in a range of 13 to 15. Then we have in adults female 11.5 gram per deciliter to 12. Then in newborn infants we have 15.0 gram per deciliter, and child of 3 months of age is 9.5 gram per deciliter. So remember these values, they are important. So now what is anemia? So anemia is characterized by deficiency of hemoglobin in the blood. So anemia, it is a condition in which the oxygen carrying capacity of the blood is reduced. So it can be caused by either too few blood cells or too little hemoglobin in the cell. So now if the hemoglobin so now if the amount of hemoglobin in the blood is less, ultimately the oxygen carrying capacity of the blood will be reduced, because this hemoglobin molecule, which consists of two alpha chains and two beta chains. So the the iron molecules are responsible for carrying the four oxygen molecule. So if the level of hemoglobin is less, the oxygen carrying capacity will also be less. So it can be caused, both these condition can be caused by either too few blood cells or too little hemoglobin in the cell. So if the blood cells are itself less, or ultimately the the level of hemoglobin will also be less. Now, how you are going to identifications of anemia by blood smear. So now how you are going to identify that there is a anemia or there is a low level of this hemoglobin in the blood. So it is done by a blood smear. That is, the hemoglobin estimation is invariably followed by examinations of peripheral blood film for morphological features after staining with a dye, that is Romansky dye, which mostly uses a Leishman stain, and there are some other stains also, but most commonly used stain is Leishman stain. So we'll see now how it is done. So blood smear. Now how blood smear is test is done? It is first you have to keep the slides ready, that is at least 2 or 3 slides you are supposed to keep the ready, because if one fails, then you have some secondary option, like you have to take a slide, ensure that it is clean and sterilized properly. It should be clean. So then you have to take prick your finger, mostly the index finger. Wipe your finger with the cotton or with the alcohol, or sterilize it. Then let it dry. Then you can prick your finger with a lancet. Once the blood oozes out from your finger, take a small drop of your blood on the slide as shown. Once you have to take another slide and spread that drop of blood on the slide. Once you spread that drop, it should be in the shape of, somewhat in the shape of your tongue. So spread it slowly, not fast. Once you are done with that, let it dry. So the spread, once the slide is prepared, you are supposed to air dry that slide for 2 to 3 minutes. Once the slide is dried, you are supposed to pour, or you are supposed to add a Leishman stain on the slide. That is, once you are done with the drying of the slide, keep the slide for at least 3 to 4 minutes in the Leishman stain. That is, once you keep the slide and put the Leishman stain with the help of pipette, keep the slide in that stain, or with that stain, for at least 3 to 4 minutes. After 3 to 4 minutes, you are supposed to dilute that slide. That is, with the help of a pipette, or maybe, yeah, with the help of a pipette, you can just pour a little drop of water slowly by slowly, or you can just take a big water in a beaker and just slightly pour on that slide, so that the excess stain, the Leishman stain, is washed out from the slide. Once you have diluted or washed the excess stain from the slide, air dry your slides again. Air dry your slide. Once the slides are air dried, you are supposed to mount the slide in the microscope to observe the various changes in the shape, size of the RBCs. So abnormalities observed in the blood smear. The following abnormalities in the erythroid series of cells are particularly looked for in the blood smear. So what are those changes that are observed are variations in size, which is called anisocytosis. Then we have variations in shape, which is called poikilocytosis. Then we have inadequate hemoglobin formation. So when the level of hemoglobins, or some content of hemoglobin is less, the cells will appear pale in color, which is called hypochromasia. And there are some other miscellaneous changes that you will be observing when you all are going to observe this slide, which is stained with the Leishman stain, into the microscope. So cells will appear somewhat pale, the size of the shape will be different, then some cells will look like will shrink, or maybe the size cells will increase their size. So all those changes will be observed in that slide. So now what is the actual cause for this anemia? The main cause for anemia is the low iron levels of iron level in the blood. Now we know that this iron Fe3 plus, which is present on the chains of this hemoglobin molecule, responsible for transport of oxygen. So if the level of these ions itself are less, the oxygen carrying capacity will ultimately decrease. So when these levels are low, whenever you eat anything that has the ions content in them, but they are not getting absorbed properly due to some changes in the body. So when the low level of ions in the body are less, secondly, you are uh, you are not taking the supplement which has a iron has a major source, or you can say the amount of ions that you are taking is too less. So that can be one reason. Then the second reason can be production of insufficient or defective erythrocyte. So we have already done now the how erythrocytes are formed. So the form erythrocyte, they can be either insufficient or they are formed in sufficient quantity but they are not mature, or maybe they are defective. So that can be one case. Insufficient RBCs, that means ultimately the hemoglobin level will also be less and oxygen carrying capacity will also be less. And another cause is blood loss or excessive erythrocyte breakdown. So blood loss can be in case of any accidental injury or heavy loss of blood, then excessive erythrocyte breakdown. So now if the RBCs are formed in sufficient amount, but the amount that is formed, like if the 100 RBCs are formed and out of them at least 90s are getting degraded or they are getting breakdown, so the ratio will be less, right? The amount that is formed is not meeting the requirement that is required in the body, that is excessive amount of erythrocytes are getting broken down. Another cause can be depression of bone marrow. So now we know bone marrow is the site where from where the productions of RBC starts. So if the bone marrow itself is has some problems, or if there is some defect in the bone marrow, ultimately the erythrocytes will be less. So depressions of bone marrow can be caused by toxins, or it can be caused by drugs which are used in case of treatment of cancer. So signs and symptoms of anemia are fatigue, then we have irregular heartbeat, chest pain, dizziness, headache, weakness, shortness of breath, and yellow or pale skin. Next part is types of anemia. So different types of anemia are iron deficiency anemia, then we have a vitamin B12 or folic acid deficiency anemia, aplastic anemia, hemolytic anemia, in that we have congenital hemolytic anemias and acquired hemolytic anemia. So now we'll see each one in detail. So in iron deficiency anemia, which is the most common type of anemia, so women are at a greater risk for iron deficiency anemia because menstrual blood losses and increased iron demand of growing fetus during pregnancy. So it can be because of the iron intake is very low, that is deficient intake, so higher requirements are required, and due to malabsorption, so iron that you are taking is not getting absorbed properly. Next we have vitamin B12 deficiency or folic acid deficiency anemia, which is also called as a megaloblastic anemia. So in this case, deficiency of vitamin B12 or folic acid impairs, which causes low reproductions of erythroblasts in the red bone marrow. So now because of this vitamin B12 deficiency, the reproductions of this erythroblast is low. So that is the reason why large erythrocytes are formed, that is abnormal large erythrocyte, which are called as a megaloblasts, that are formed in the blood. So that is why it is also called as a megaloblastic anemia, because the shape of the cells is very large, abnormal as compared to the normal cell. Next we have vitamin B12 deficiency anemia, which is also called as a pernicious anemia. So it is an autoimmune disease that destroy the intrinsic factor and gastric parietal cell. So we'll be studying about these factors in detail in our next class. So dietary supplements of vitamin B12. Then other causes of vitamin B12 deficiency can be gastrictomy, or it can be chronic gastritis or malignant disease and ionizing radiations, malabsorptions of the vitamin B12 and other complications. So that can lead to vitamin B12 deficiency. Then we have a folic acid deficiency anemia. So megaloblastic anemia, not with the neurological damage. So it can be caused due to dietary deficiency. Then we have a malabsorption from jejunum, which is called by celiac disease, tropical spear, or anticonvulsant drug. So other cause can be interference with the folate metabolism by cytotoxic and anticonvulsant drug. Then we have aplastic anemia. So it results from the bone marrow failure, that is due to lack of bone marrow functions. It can be due to it can lead to anemia, leukopenia and thrombocytopenia. Then causes of these are, that is causes of why this red bone marrow failure is, it can be due to consumptions of drugs like cytotoxics and rarely adverse reactions to anti-inflammatory and anticonvulsant drugs. Second cause can be ionizing radiations. Then we have some chemicals like benzene and its derivative that can also lead to destructions of these bone marrow. Then in case of exposure to gamma rays, like in case of nuclear bomb blast, it can also lead to destructions of these red bone marrow. So next is viral diseases including hepatitis can also lead to destructions of bone marrow, or it can lead to aplastic anemia. Then we have a hemolytic anemia. So this can occur when circulating RBCs, they are fragile, or they are destroyed prematurely when they are passing to the capillaries or blood vessel. as they are abnormal or the spleen is overactive. So the release of hemoglobin pores into the plasma and they may damage the filtering unit. So now as they are destroyed when they are passing from the capillaries or blood vessel, the hemoglobin will be poured into the plasma. So ultimately this will damage the filtering unit, that is the glomeruli, that is nephron in the kidney. The last one is congenital hemolytic anemia. So it is a disease which is genetically inherited. So the disease is because of genetically abnormality leading to synthesis of abnormal hemoglobin and increased red cell membrane fragility, reducing their oxygen carrying capacity and lifespan. So there are most common types of anemia. In this case is sickle cell anemia, thalassemia, and last one is hemolytic disease of newborn. So we are going to do about this disease in detail because it is mostly been asked in the exam and it is mentioned in your syllabus. So this will be done in detail. Now sickle cell anemia, as I said, it is a genetically inherited disease. So there is inbuilt abnormality that is there. So sickle cell anemia, they have a abnormal type of hemoglobin. These cells have abnormal types of hemoglobin which is called as a hemoglobin S, which contains faulty beta chains in the hemoglobin molecule. So when this hemoglobin is exposed to low concentration of hemoglobin, it precipitates into long crystal inside the red blood cell. So now you all can see these are normal cells and these are sickle cells. So because of this faulty beta change, it will form a, it will change their shape, that is it will form the long crystal inside the red blood cell. So yeah, that's it. So we are done with the anemia. In detail, you all are going to do this in pathophysiology part. It is there for you all in the pathophysiology, that may be for your SEM 3. So right now, just right now, just anemia and types of anemias is sufficient. Thank you.